Hello, my name is Anne Preston with the Rural Wisconsin Health Cooperative. And as a result of Flex grant funding through the Wisconsin Office of Rural Health, we are creating these videos on the topic of communication. I had the great pleasure of being joined on this video series with a group of folks from Southwest Health in Platteville. Doctors, pharmacists, nurses, phlebotomists, housekeeping folks, EMT, administration, and so on. Folks just like you who are doing their best to try to create an excellent patient experience. And so they joined me to do some interviews and some role plays of some of the skills that we're working on in these videos. So I really want to put a shout out to them, to thank them for participating, and hope that you find that you can relate to some of their real life experiences working with some of these challenging communication situations. This series of 3 videos starts with our first topic of working with patients or family members who are upset or emotionally charged in situations. The reason this is important is because no matter what you do in healthcare, there's going to come a point when you're going to be interacting with a patient or family member who is unhappy or upset about something that's going on with their care. Because when you think about it, we don't go into a hospital or a clinic setting when things are going well. Things are often chaotic for people when they're coming into a hospital or to a medical appointment. And there's always some level of fear that's going on for a patient. So we're going to talk about that in this first session. You'll have an opportunity to work with a handout that's got some homework assignments for you and opportunities for you to practice for whatever situation you might find yourself in when it comes to dealing with someone who's upset. The key to starting with this is understanding that it's not about you. It's about fear that's going on with that patient.
Yes. I mean, there's times where people come in and you can just tell they're having an off day, especially if they're patients that come in all the time. You can tell they're having an off day, and just a simple, "How are you today?" and them being able to express themselves helps them get through whatever they're going through. Being able to say out loud what's bothering you most times gets it off your shoulders and makes you feel better. So just being able to be personable with them helps. Remembering that patients feel fearful out of anger. Sometimes fear comes off as anger because our emotions just kind of get out of control and we speak before we think. And we've all been patients in our lives. We're not just healthcare workers, we're healthcare workers and patients. So remembering to put yourself in their shoes, and when you're scared, sometimes you get angry, and you don't mean to come off as that. So looking into what the patient is really going through and be able to sort of be empathetic for a second and know that what they're going through isn't fun.
Well, you always need to do an assessment to find out what's happening and what happened to bring the patient to the point of being upset. And I approach it by, first of all, listening. You need to listen and not give an opinion or retort until you understand what's happening. And I find the best way to approach that is to listen to the patient's story and then more or less repeat it to them so it acknowledges that I've heard it and I've understood it. If I say back to them, you're upset about the fact that you had to wait, or you're upset about the fact that the nurse didn't seem friendly. And so you repeat what their concerns were, and that generally has a very calming effect because now they know, well, at least they understand what I'm upset about.
Our objectives for our session today cover a wide variety of skill-building topics for you to build in yourself so that you can be ready to handle these situations that come up with patients who are upset. Number 1, understand what is going on behind the disruptive behavior. So again, it's not about you, it's about the patient, but what's really going on there? Number 2, identify 3 things that you can say or do to address an upset person's underlying needs. It's always about addressing the needs that are there. Number 3, learn 2 tips for managing your own reactions to another person's behavior. Because in fact, Someone else being upset with you can often push your buttons, and how we handle ourselves in those moments makes all the difference for both the patient and for you. Number 4, create a phrase that you can use to set a boundary so that you stay safe and still stay compassionate. There will be times when you have to set a boundary, and the patient may cross that, and you have to be ready for that so that you know what to do and say. And 5 and 6, I want you to assess your current level of skill in addressing an emotionally charged situation, and then set a goal for yourself. You'll have an opportunity to do that as we think through the skills today, and set a goal for yourself about how you want to improve one thing in you to address emotionally charged situations with patients and or family members. So we're going to take a look now at a situation where a patient is upset about their bill and is coming in to complain. And I want you to pay attention to what's going on with the patient and what she might be thinking or feeling behind the words that you see.
I need to talk to you about this. I came to the doctor, maybe was only here for 10 minutes, and now I'm getting this ridiculous bill. I cannot afford to pay this. My husband's been laid off. I do not understand how your hospital can charge so much money for me only being here for 10 minutes. This is ridiculous. Like, what does your hospital expect me to do? Like, what am I supposed to do about this? I cannot pay this, especially for the service that I got. I just don't understand why my insurance did not pay for this. I mean, I need you to help me figure out the answers, because I just cannot. I can't afford to pay this right now.
So what you noticed in the video there was a patient who's very upset about her bill. And if you can put yourself in the position of the staff member in that situation, imagine someone yelling at you about something that happened to them that's not your fault. Maybe it's a bill, maybe it's a patient who doesn't want to wear a mask or wants to visit a family member and there are visiting restrictions or some other reason that they're putting it back on you. It's very natural to want to react. And so the temptation is to want to defend what we have done. And what you notice on the facial expression of the employee in this video is a calm demeanor. She leaned forward, and you'll notice that she didn't say very much at all at the very beginning. She just let the patient vent and have her say. So listening is a key piece that needs to happen. The other thing that I want you to think about is when you are faced with a situation like this with a patient, is think of the patient or family member as vulnerable. Think about the fact that it's annoying and it's inconvenient to get a bill that you don't know how to pay. You don't know how you're going to pay that bill. You're already upset maybe about being sick, and now here's this bill or here's this policy that makes your life inconvenient. There's fear because there's not an unknown. There's a feeling of loss of control and the inability to make things work for yourself and your family. Maybe this person sitting there with this bill is thinking, I not only have this bill, but I have several others, and I had to get a babysitter to come here and talk with you. All of those things are inconvenience. So while we are here to help, in some ways a patient being with us or a family member being with us represents a time in their life that's not a good one. So the key to ourselves is think of this person as vulnerable, and that's our opportunity to respond from that place.
Some of the things I tell myself when a patient comes in upset is to don't say anything at all. Let them get it all out, let them be angry, and then once they stop talking, that's when you step in and you kind of repeat everything that they've said back to you. You say, okay, this is what you're telling me. This is the situation that happened. This is why you're upset. Now let me see what I can do for you. So to me, it's not always coming out and saying anything right away. It's knowing when to not say something is the key when someone's upset.
When a patient is upset and they're coming at you, a couple of things to keep in mind is that a patient is experiencing probably one of two things: a perceived loss of control or a perceived loss of respect. So think about that word perception. You may not be disrespecting them, or you may not be taking over control, but that's how they're feeling at that moment. So if we can respond to one of those two things, where we try to give some control back to that patient, or we try to show respect through being honest with them in a very caring and empathetic kind of way, it's really helpful. So a couple of things to think about when you're trying to give someone back a feeling of control, when they feel like they've lost control, maybe over their health, their family, their work situation, their life situation at that moment, their finances. Give them choices. Say, if this or that. There's a couple of ways we can do this. So giving people choice is a way to show respect and allow people that sense of what we call agency.
People want to have agency. They want to have autonomy over what is going on in their life. And when you're in a setting like this, oftentimes they don't. The only thing they have agency over is just, like making the appointment. And then for 2 hours or the next 2 days or however long whatever is happening is going on, their agency is given up to the people within the hospital, right? To the staff and to the circumstances that are happening in that hospital. And so that loss of control can be very vulnerable. It can make people who have felt in control their whole life be completely different people because we're putting them in situations that they've never been in before. So that is really hard. And so to keep that in mind, that as human beings, we all want control, we all want agency over what we're doing. And in certain settings, we have to take some of that to heal and to get people better. But walking that tension between we're in control of the situation because that we're giving them the care that they need, and at the same time giving them as much control as possible.
The other thing that you can do to show respect is there's a number of things to think about saying as you are in that situation that you want to show respect. And this isn't about telling you words that you have to say, but it's about being ready for someone coming at you with their defensiveness so that you don't get hooked in. Here's a number of things that you can think of to say. Some key phrases include, "I know this is upsetting." Now, there's a period at the end of that. You don't have to go on and say why it's upsetting, but just acknowledging someone by saying, "I know this is upsetting to you," really just helps to validate their feelings. It doesn't make them right or wrong. It just validates their reality. You might say, "I understand this is stressful for you in this situation." Similar kind of thing. Or, "I can understand this is terribly difficult to not be able to visit your family member, not be able to be mask-free, not be able to think about how you're going to pay your bills. I understand." Just using those two words, I understand. Because we've all been there. We've all been in those situations. And here's the key thing. When we do our jobs all day, every day, it makes it hard to remember what it's like to sit on the other side of the desk. So that's what we're bringing each day as we think about this. You listen for needs. Here's the other piece about that, is when someone is complaining, very often there's a need there that they're trying to express. So how can we listen for maybe what's not even being said? So think about, help me understand what is most concerning to you right now. Maybe there's a way that we can address that. So you might not be able to understand what their needs are, but if you ask, help me understand what's most important to you right now, and then we'll see if we can find a way to fix that for you. Even it's maybe not the way they want you to fix it, but you still can address that problem.
I think the way that I try to make sure that every patient is treated as an individual and not a number is to correlate them as a member of my family, grandma, grandpa, mother, father. I try to treat them as, if they were a member of my family, how I'd want them to be treated. My role as a referral advocate is to advocate on behalf of the patient, and so I want to make sure that they have a clear understanding of what the next step is. Oftentimes they have things that are, majorly wrong with them, and I want to make sure that my portion of their visit to the hospital is taken care of and they understand my portion very well.
So when you get hooked, your emotions get caught up, or you're being almost attacked by a patient or a family member, what do you do in that moment?
But I think in nursing, the most important thing to think is there's a reason. It's not you, first of all, getting past it's not you. Usually it comes from a place of the patient is fearful about something. Let's say they're fearful about a procedure, but they're projecting it onto someone. So I think just knowing and coming with that piece that it's not about you, it's about the situation. So just finding out what the underlying cause is. Maybe they're fearful of the procedure, so they're taking it on you, but they really just need it explained a little bit better to them, or maybe they're uncomfortable. So really just coming with a deeper understanding that this isn't all about me and not taking it to heart, but yet getting to know what the underlying cause is.
Yes, I know I've said that before too. Let's both take a deep breath and let's see what we can do. You actually say that? I do. Yeah, I do, because sometimes we both need a deep breath. Like, let's get started. Let's both take a deep breath and let's take a look. Yeah.
You heard it here, breathe. Breathing is one of the first things that you do. It seems so simple, I almost don't want to say it, but it is the most important thing to do, because what happens when our emotions get kicked in and our amygdala gets kicked in, we react and we start holding our breath. So do take that deep breath and remember that that's most important. Pause and listen. Listening is the most important thing that you can do. We often worry about, what am I going to say? What's the right thing to say in this situation? And what the most important thing is to say is really nothing, really just listening. A couple of other tips for you is think of your on-stage face. So we have at work on-stage and off-stage. On stage is any time we are with a patient or coworker or family member or other customer. That means I'm here at work, and even if I'm having a difficult time, I'm going to bring you my best all day, every patient, every time. So on stage face, what does that mean for you? Think of the phrase Q-tip. Q-T-I-P stands for quit taking it personally. Maybe even put a little Q-tip on your desk if you need a reminder, because as I said at the very beginning, a person's behavior when they're upset, when their life is in chaos, is not about you. It's about what's going on inside of them. Get support for yourself if you need to. Perhaps you need to talk with your manager or say, to the patient, give me just a minute, let me get my manager here to help with this. So don't feel like you have to handle these situations alone if it gets too uncomfortable. The last thing I would say on this list is wish them well. It is hard to get upset with someone when you are wishing them well. So someone's coming at you with their frustrations and their anger, and if you can go inside and think about, I wish this person well. I want what's good for them. When we change our mindset, our behavior and our words will follow. So think of those words, that phrase, wish them well.
So acknowledging what is ours to acknowledge, and saying, I'm here to work with you, or to continue to allow them to work through that immediate frustration so we can get to the actual core of what the person wants, which is, I want to be treated fairly. I want to be seen as a person, I want respect as well. So I want to understand what's going on here. And we can do that if we can keep our heads calm, if we can take deep breaths, if we can detach our personal, feelings from the situation.
So let's say that it happens that you need to set a boundary. It's not just someone having an upset conversation and you're able to kind of calm them down with your demeanor and your good listening and you're saying that you understand. Let's say that it gets to be where it's really uncomfortable for you and you're not feeling safe. It's really important to be able to set a boundary in that situation, and it's compassionate to do that. The way you do it can be compassionate or not. So think about the ability to say, I really am here for you, and I want to help you, and I need you not to swear at me.
So yeah, there was an altercation with a patient that I was a part of, and a different director came in and talked to the patient after I had finished seeing the patient, and He was very good at setting boundaries with this patient. He said that this kind of behavior would not be tolerated, where the patient made some offhanded comments that upset the worker that was in with the patient before me. And he did it in a way that was concise, so the patient knew exactly what he did wrong, and he did it in a way that was calm and a calm demeanor, and was able to get that point across to the patient that this would not be tolerated, and if that it was to continue, that other options would be explored for his care. And it was a very quick interaction, just a couple of, not even probably 2 minutes, and it was very effective. This is still a patient we see today, and we've had no incidences since then, so even with that employee still involved. So
you can also try an if-then. If you can lower your voice and sit down and talk with me, then we can problem solve and see how we can sort out this situation for you. So an if-then. It also gives that person a choice. And again, back to choices, people feel empowered when they have a sense of choice. So giving them the choice, if you do this, then we can do that. If you will stop yelling at me, I will see what I can do to help you. I'm in your corner, and I want to help you solve this. So always going back to that purpose, I want to help you solve this. So the bottom line of managing yourself and dealing effectively with upset behavior that comes at you from a patient is really remembering that compassion. It can be hard to do. So let's say you're having a tough day, things aren't going so well for you, and then a patient comes in and they're upset. It becomes the opportunity for this to be kind of combustible. But go back to that on-stage performance that is so important for you, and remembering that the patient is fearful. And part of your job, no matter what your role is in healthcare, is easing fear, calming anxiety, because when we do that, the patient has a better outcome. And they're much more likely to get the care that they need, to be in a place where they can receive the information that's so important for them to get better. And you're a part of that. Everybody who is walking in the door in your organization is a part of making that experience a positive as possible experience as it can be for that patient. So you have an opportunity now to think about, how are you doing already at managing these difficult situations? Whether it's with a patient, a family member, or maybe a coworker that you struggle with, how are you at managing your emotions? And then, how would you like to be? Would you like to make an improvement? On the worksheet that accompanies this program, you have an opportunity to look at setting a goal for yourself that you can improve how you want to be in these situations, so that you can respond with your heart in the right place and for a good outcome for the patient. As we wrap up this session, I want you to think about 3 things. Talk to your teammates, folks who you work with regularly, and think about what kinds of situations might you face in dealing with upset patients or customers. Number 2, go to your manager, and your managers will also be getting a worksheet that they can follow up with you on this kind of content. So be thinking about how in your department specifically, in your unique role, how will this come out to play for you so that you can be ready for situations that might be unique to the kind of work that you do. And the third piece is, as you set your goal, think about taking away one thing that you're going to do or say differently, or try to build into your repertoire of addressing situations where people are upset. This can be at work, this can be at home, but it's being ready to communicate in a positive way. At the end of the day, it's all about communication. Thank you.